Hello, everyone. It is a pleasure to meet all of you. Let me introduce myself. I'm Dr. Balasubramanian. I'm a pulmonologist who specializes in advanced lung disease, pulmonary hypertension, part of the Valley Advanced Lung Diseases Institute, Fresno, California. Today, we're going to talk about the role of echocardiography in pulmonary arterial hypertension care. I'd like to thank United Therapeutics for sponsoring this particular segment and I'm making this presentation on behalf of United Therapeutics. Speakers are compensated by UT. The information presented here is for educational purposes and is not intended as professional medical advice. Always discuss your individual test results and any questions you may have with your healthcare provider. Here is an overview of our presentation today. We'll take a look into what the heart actually does in pulmonary arterial hypertension and what is your doctor looking for on an echocardiogram. And we'll also take a deeper dive a little later during the presentation into some of these aspects. What happens in the heart in pulmonary arterial hypertension? The heart has two sides to it, the left side and the right side. The main aspect of the left side is to pump the blood from head to toe. And the main purpose of the right side of the heart is to receive the blood from the rest of the body. And when the blood comes to the right side of the right side of the heart then has to pump this blood into the lungs. And this is done normally effortlessly, as the lungs are conveniently situated right next to the heart. But in pulmonary arterial hypertension, the blood vessels within the lungs get progressively narrower. That means that the right side of the heart now has to pump harder. It has to work harder to pump the blood into the lungs, which results in strain of the right side of the heart, and it starts becoming larger and also becoming weaker with time. These changes in the right side of the heart are often one of the first signs of pulmonary arterial hypertension that it's getting worse, and can also indicate that it's getting better based on if somebody is on appropriate treatment. The changes in your right side of the heart, as seen on an echocardiography, can also be indicated indirectly by changes in some blood values like BNP, which is a blood test that you may be familiar with. Your doctor might be requesting on a regular basis. BNP is a protein within the blood, basically indicates that if the heart is working extra hard, then the BNP is secreted more. So if the BNP is lower, that means the heart is squeezing effortlessly. The higher the BNP, that means the heart is straining more. And this can parallel along with changes in functional class, which is a subjective aspect of how well a patient is doing, or how much does it take for somebody to become symptomatic. As a PAH condition progresses, it can eventually lead to a hospitalization. The inverse is also true. As the pulmonary arterial hypertension improves, so does the changes in the right side of your heart, and obviously changes in your BNP and NT-proBNP, as well as changes in functional class in the favorable way from functional class 4 to class 3 to class 2, and improvements in 6-minute walk distance as well. How do we monitor the changes in the heart? Two important tests are right heart catheterization, a direct measurement of blood pressure in the right side of the heart, and then the echocardiogram. So, as you may recollect, when you go to the doctor's office, they slap a cuff around your arm, and this measures the pressure at which the blood is circulating through your body. The right heart catheterization measures the pressures in the heart directly, in the heart as well as the blood vessels of the lungs. It also indicates how well the heart is pumping blood. Now, these measurements are used to not only diagnose and confirm pulmonary arterial hypertension, it can also help to determine disease severity, monitor changes in pulmonary arterial hypertension when compared to prior results. Information gathered from the right heart catheterization can help provide various important details. One of the important things is pulmonary vascular resistance. which is basically a measurement of how the blood is flowing through the blood vessels, an indication of how difficult it is for the blood to flow or how much resistance it experiences. Pulmonary capillary wedge pressure is basically a measurement that's indicative of the filling pressure of the left side of the heart. In other words, all of us need a certain amount of volume that needs to be circulating through our body. And the left side of the heart is the part of the heart, as you know, that squeezes the blood from head to toe. So we need to get an idea as to what is the total output of the heart. And the pulmonary capillary wedge pressure is that particular measure that gives us an idea about this filling pressure on the left side of the heart. This is measured when they do the catheterization. The tip of the catheter has a tiny little balloon, and as they advance the catheter into the blood circulation in within the lung blood vessels, at a certain point, the balloon completely occludes the pulmonary blood vessel, the smaller blood vessel, at which point it becomes like a manometer. So the pressure at the tip of the balloon is basically the same pressure on the left side of the heart. And now this is such a crucial kind of a measurement that gives us very important information about what we refer to as the filling pressure of the left side of the heart. The pulmonary arterial pressure, on the other hand, is just a direct measurement of the pressure at which the blood is circulating within the blood vessels of the lungs. Here, the right atrial pressure is basically the smaller chamber on top of the right ventricle, and this is the chamber that receives the blood from the rest of the body. And obviously, it gives us an idea of what the pressure is on the right side of the heart when it first receives the blood. And then the other important test is the echocardiography, which is basically an ultrasound of the heart, where you may recollect this test where they put a gel around your heart and they put a tight pressure on the probe and they kind of go around the heart to see the images of the heart. But obviously, when there is pulmonary arterial hypertension, the blood vessels within the lungs are narrowing, and this is behind your chest, and there is no direct way of measuring that apart from doing a right heart catheterization, which will give us that information very accurately. Today, experts use echocardiograms to monitor pulmonary arterial hypertension severity and progression. An echocardiogram is a non invasive way to monitor changes in the heart. It uses sound waves or ultrasound to create pictures of the heart. It is the most widely used tool for assessing the size, structure, and function of the right side of the heart. The echocardiogram can show a healthcare provider how PAH has affected the patient's heart, say how well a current treatment plan is working, and when a patient's treatment plan needs to be adjusted. Seeing one's heart size and function helps the doctor or the healthcare provider understand where your PAH may be headed. So, what does your doctor look for on an echocardiogram? We are looking for evidence of size and shape of the right sided heart chambers, how well it's functioning. The most common condition that most of them in the community are used to are left-sided problems, such as having a heart attack. How well is the heart squeezing? And most of the echocardiograms are going to emphasize on the left side of the heart. But when a pulmonary hypertension provider is requesting a right heart focused echocardiogram, that means that we are looking for certain other features of the right side of the heart and not only the usual left sided heart indicators. That's how the right sided heart echo is different compared to your generic left sided heart echo, which is a lot more common. Did you know that the heart appears upside down on an echocardiogram, as illustrated on this particular cartoon? And we will see some real images shortly. And you can see that the two ventricles, the right ventricle and the left ventricle, as depicted there, are on the top, and then the right atrium and the left atrium at the bottom. In the echo of a person who does not have PAH, and here is a nice illustration of what we call a four-chamber view. You can see that the right ventricle is here, the left ventricle is bigger, the right atrium and the left atrium. Generally, in a normal echocardiogram, the left side of the heart is much larger because the function of the left ventricle is to squeeze the blood from head to toe, whereas the right ventricle just needs to squeeze the blood to the adjacent lungs. Therefore, the right ventricle is smaller than the left ventricle, and the right ventricle has a thin wall and a narrow apex, as illustrated in the cartoon here. The right and left-sided atria are similar in size. What about the heart of a patient with pulmonary arterial hypertension? Here we have two pictures. We have the advanced PAH on the left side with a red label, and then a normal four-chamber view on a normal patient. So again, you can see that the right-sided chambers are significantly enlarged in patients with PAH, both the right ventricle as well as the right atrium. In this echo, the right ventricle is much larger. The muscle of the right ventricle thickens, as you can see there and illustrated, and the apex widens. The right atrium is also larger. Therefore, monitoring the right side of the heart with echocardiograms help healthcare providers to be proactive. Changes in the right side of the heart in parallel with changes in the BNP or NT-proBNP, along with functional class and 6-minute walk distances, helps to make a very good objective assessment of the right side of the heart. Echocardiograms are recommended for patients every 3 to 6 months. Catching disease progression early helps the doctor makes adjustments to try prevent symptoms before they happen. Let's take a little bit of a deeper dive. In PAH, we do something called risk assessment. As you all know, PAH is a serious disease and has a fatal outcome if we don't pick it up and treat it well. So, what we mean by risk is the risk of death. Most patients are diagnosed at the intermediate or high risk status. And we make that determination based on several kind of indicators on the left side of the table here without going into the details. These include subjective details and objective details. And the clinician has to put all these parameters together to make a very good judgment as to whether the patient belongs to a low, intermediate, or high risk kind of category. And echocardiogram and right heart catheterization play a crucial role in making this determination. And our job as a healthcare provider is to make sure that we get the patient from the high risk towards the intermediate risk, towards the low risk. And the more proactively we make an effort to get the patient to the low risk, the better the outcomes are. PAH is a rare disease, so not all cardiologists and pulmonologists have expertise treating it. It is one of those disease states where both cardiologists and pulmonologists do treat this condition depending on your respective local resource. PH experts have experience understanding echocardiograms from patients with pulmonary arterial hypertension. The specialist can use echocardiograms to interpret, say, how to make a treatment plan and how the treatment plan is impacting the right side of the heart. In summary, monitoring the right side of the heart is very crucial in the management of pulmonary arterial hypertension. Changes in the heart are one of the first signs that PAH is getting better or worse, depending on how we look at it. Echocardiogram is a non-invasive way to look at the size, structure, and function of the heart. Today, echo is an important part of risk assessment, as we spoke about a couple of slides ago. Monitoring the right heart allows healthcare providers to set and proactively adjust treatment plans that may help slow disease progression and prevent symptoms before they happen. Please ask your healthcare provider about how your heart is changing over time. Thank you for this opportunity. And if this information was helpful, please consider joining the PH Initiative at jointhephinitiative.com. And you can also follow us on social media. Thank you.